Hello, welcome to another episode of Breaking the Silence Voices of FGM Survivors podcast here on Sheetal Media Network. I am your host, Halimatu Sise. In this episode, we spoke to Fatou Camara, the gender and harmful traditional practices focal person for Ramka under the Ministry of Health. She shared with us the health implications, including financial pressures that hospitals will encounter if the FGM law were to be repealed by the Supreme Court of the Gambia. Kindly introduce yourself.
My name is Fatou Camara. I'm working with the Ministry of Health at the Reproductive, Maternal, Neonatal, Child and Adolescent Program unit as a focal point for gender issues and including traditional harmful practices for the Ministry of Health.
Right now, there is a lot of debate going on with regards to repealing of the FGM law, which is currently ongoing at the Supreme Court. We would like you to share with us what are the health implications when the law is repealed, especially on the health of women and girls.
Thank you very much for that question. The health implications if the law is repealed, it has so many numerous health implications from childhood all up to old age, because the part that they are taking out is a very sensitive part for the woman, and it helps in most of the reproductive system activities of the woman from childhood up to old age. Like if the girl child is being circumcised, the clitoris that is being cut off, it has a very sensitive nerve endings around that end. So if that is cut off, the person can develop neuroma, that is can be always be having that sensitive pricking sensation around that end. That alone is a health issue for that individual, because he cannot put on tight pants because they will always be irritating her in that area. And the other health implication that it can have at that early age is it can have some psychological effects, because if she has gone that traumatized nature of how it has been done, it always triggered her to have that psychological implications for her. And the other thing is, like, it is divided into three stages, the complications. You have the immediate, you have the short term, and you have the long term complications when it comes to health. And the immediate complications that we always see at our health facilities is bleeding, because like I said, the area, the nerve endings there are also very deep blood vessels lying underneath the organ itself. So if the individual doesn't know the anatomical structure of the area, they cut on they touch those arteries, big arteries, to have those things being repaired at their level is almost impossible. So these children will bleed to death, or they can bleed, go into anemia, go into shock before you can resuscitate them. Is another whole lot of health implications. The other one they can have immediately is infection, because we all know how it has been done, where it has been done, who does it. All those sterile procedures are not taken into consideration, so the guy can develop infections, and that infections can follow this individual up to old age, because like we said, the female anatomy, the door is the vaginal orifice. Anything that enters can ascend to all the parts of the reproductive system. So you can see some of these women, they can be barren tomorrow, but it started during the course of going through this process. They can pick infections that, when they are not treated, can ascend to those upper reproductive health system, and it can cause infections for them that are not treated, that can lead them for them to be barren. They cannot have children again. But we might not see the point at that there, but the point must have been since childhood, since they have gone through that circumcision, infection procedures were not being followed, they got infection, they can have those issues. The other thing that can also come up is like they can have urinary retention, we can also affect their bladder because it's a raw wound. If you cut this individual, they are afraid to pass urine because we know all urine is acidic. So if they pass urine, it can hurt them. It's very painful. So they will rather retain the urine within them so that they will not pass urine. And retention of urine, which is go out, can also be an infection for them. It can infect their blood, and that can also be a long-standing problem for them in the future. And the other thing also is what can also happen during that time also is like the area could be necrotic because we know how they take care of, because they put their legs together, and a raw wound where air is not entering to make that place heal becomes a problem. So the vulva can be odematous, it can be gangrene. They bring them to the health facility when the whole the external vulva is almost all rotten. So we have to take care of that. So these are some of the things that can immediately affect these people when they just take them. The other short-term ones can be when it is time for this girl to start having menstruation, because when they do the cutting, sometimes they will seal, and if they seal, they just leave a small hole just for the passage of the menstrual flow. And sometimes for that menstrual flow, blood is not like water. If you pour water here, it can find its way and go, but if you pour water, if there is a blockade on the way, it will not come out, it will stay there. So that will happen to these young girls. You can see them, they will go through a hell lot of menstrual pain. They will go to the health facility, they can miss their classes. So it's a hell lot of health issues that are there. Sometimes we see them, they will have their menses, blood will not come out, it will accumulate in their uterus. We have to tap going through the abdomen to make sure that we withdraw that blood coming out from them, because some of them, the sealing that they do for them is very, very severe. It even prevents that blood flow to come, so the blood will accumulate in their uterus. We have to tap it out for them. If you see them, you'll think that they are 2 months, 3 months pregnant. Why? It is not. It's the blood that should come and even accumulated there, so it has to come. And when it comes to labor and delivery, that's the worst part of it. We have to give them episiotomy, which should not happen in normal circumstances. They should not have gone through that, because they are not clothes in the market that you have to be tearing and repairing always. So that structure that they do took out during labor, that helps in stretching the vaginal orifice so that the baby's head can come out. But if there is that scar, stretching cannot take place. So obviously what would happen? A tear will occur on top, which we cannot do anything about. And then we have to do another tear, that is episiotomy medically, so that the baby's head can fit in, which in normal circumstances should not happen. If that space, if that clitoris is there, it helps in widening the vaginal orifice, and the head can just slip down and then come out. But if that scar is there, the scar is not stretching, we have to control that scar to make sure that even if it is going to be teared, it will be little, but we have to cut this woman to make sure that the baby's head comes out. If we don't do that, the baby's head cannot come out. So that's the most painful part of it all. And that episiotomy, after, you have to take care of it. Sometimes to see these women, even to sit down, become a problem for them. And it's not only for the woman, the baby too. Because if the baby's head should come out and it is not coming out, the pressure that is applied onto the head can also damage some of the nerves in the brain. And that's why some babies, if you see them, they deliver, sometimes if they should walk early, they will not. If they should talk early, they will be. Their brain has been affected during that difficult delivery that they were having at that time. Parts of their brain that is responsible for some of those things have been affected. But what would we say in the community? Maybe it's evil spirit and they like. No, it's not evil spirit. It's a difficult delivery that they have gone through, because the baby's head, if you touch the baby's head, there are lines that God has put there. Even if the space is that tight, they can a little bit override to make sure that the baby's head comes out peacefully. But if there is that man-made structural problems around that end, they will overlap seriously, which can affect baby's brain, and when they come out, they can also develop some of the issues, that health complications that we see some of our children go through. So basically, these are some of the things that we are seeing in our health facilities, and we are trying as much as possible to make sure that we train our nurses to be able to help these women when they come into our health facilities.
What are the financial pressures? What would the financial pressure be like?
The financial pressure, like we said, because if they come to our facilities, if nothing is wrong with them, they will not have any problems. But if they come to our facilities with all these problems, obviously the drugs that are going to be prescribed for them are going to be paid for by the government. The materials that are going to be used during labor to do the episiotomies, to do the suturing, are going to be paid for by the government. So that money could have gone into something else rather than being put into a man-made catastrophe that is being done by us. So that money that has been used to treat these people could have been put into some other things that can prevent our women and our girls from dying from other complications, not in relation to complications caused by FGM. So that burden, and the amount of money spent on those things are enormous. Because if you go to a health facility, sometimes they will a suture. If you ask for a suture, you can buy it for $150. Say you buy needle and syringe, that can cost you $25. So how many women are going through that process? That money, if you add it together, is a lot of money that can do some other things that are very much important to women's health than putting them on addressing FGM issues.
Since the ban on female genital mutilation to date, what were the positive impacts that you witnessed in the facilities?
The positive impact that we have realized is that at least some women have this understanding that it has health implications on them. That's why it is banned. So what we tell our nurses is, if you see some of these issues, please call the relatives, ask the permission of the woman that you want the expert to come and see what is holding you here. Sometimes it can make their labors to be prolonged, and that prolonged of labor also have its consequences. Like at the end of the day, they can bleed, and we all know to get blood in this country is a nightmare. You can tell someone to come and donate blood, will think that the next minute he is going to die. So if that woman is going to, because the uterus is such that if it is good, if it goes beyond its limit, at the end of the day, it will say, I'm tired. So if it says, I'm tired, for it to contract again to stop that bleeding becomes an issue. So having blood in this country is an issue. So most of our women are dying. The underlying factor could be FGM could be contributing to it because they've been in labor too long. And FGM also is a contributing factor to some of those prolonged labors, that delayed labors that we have. So it could be a contributing factor. So what is positive about is that women are aware and they know the complications that are there. What we used to see happening before the ban, now we are not seeing that happening. I know they could be doing it in hiding. So that doing it in hiding, some of the complications will reach facilities very late that we cannot do much about. Those are some of the things that we are saying, because it's banned and people are still doing it. So if they develop complication, rather coming to the facility early, deter them from coming early. They will rather come late when they have no other option. That's the time they will come. And when they come at the facility, we don't have any other option for the individual. At the end of the day, will have to succumb to the injuries that is being done. Those are some of the things that we are seeing.
What message would you like to give to lawmakers?
The message that I would want to give to lawmakers is, let them stand firm on the promise that they have taken, that they are going to uphold the law for the ban not to be repealed. And in doing so, they are doing great for the health sector, especially, and for the women of this country. Because I know, like I'm saying, they will do it in hiding, but as generations are going, it will one day be a history. But this law will help us make it a history. If the law is not there, people will still continue to practice. But if the law is there, gradually, people will come to their minds, and then with the sensitization going on about all the implications that are there, be it social, be it economical, be it health, that can change people's mindset towards the practice. So I want the lawmakers to stand firm on what they've said, that they are not going to repeal the law. Let them stand firm on that, no matter the intimidation, no matter the talk, let them just uphold the law for Gambian women.